morning. My name is Sharonda Leggett, and I will be doing a full comprehensive assessment on you this morning, okay? All right, can you start off by telling me your full name?
My name is Dexter Doe.
All right, and Mr. Doe, how old are you?
I'm 32.
Good, okay. Can you tell me what brings you in this morning?
My former Oak health provider, she's retiring and she's moving away.
I understand, so you're looking for a new provider?
Yes.
Okay, I understand. So tell me, what kind of health problems do you have, or do you have any health problems?
I had a high blood pressure
Okay.
and a case of asthma in the past.
Okay, I understand. And as far as your high blood pressure, do you take any medications for that? Do you take any medication for your blood pressure?
Yeah, she had me on some. It was mild.
Okay, and do you remember the name of that medication?
I don't know the quiet name. I think it started with a T.
Okay, triamcinolone hydrochlorothiazide.
That sounds
Yeah,
right.
is that it? Okay. And what about for your asthma?
I don't take the medicine.
No medication for that, okay. Now, I was looking back in your notes and I saw that you had ordered for an albuterol that you can take as needed. Do you still take that, or you don't really take it because, do you feel like you don't need it, or you just don't take it just because?
I don't need it.
Okay, good. Do you know the dosage of that, of your hypertensive medication?
I'm not sure. I think she said it was a low dose.
Okay, and we can go back and look in your charts for that also. Do you take your blood pressures at home?
Every now and then,
Okay, do you know what they typically run?
maybe once every 3 days.
Okay, do you know what the top number is normally? Is it, no, okay, that's okay, that's all right. So, as far as allergies, do you have any allergies?
Well, it does mold and like pets.
Okay, and what kind of reaction do you have to those allergens?
Mainly like sneezing.
Just sneezing, okay, so just kind of irritate your sinuses a little bit, okay, I understand. What about, your family history? Mom and dad still alive and well, or?
Yes, mama and dad is both still alive. I think they got a small case of high blood pressure too.
Okay. What
Also,
about,
I have a brother that have high blood pressure.
okay, and does your brother have diabetes?
No, he just, with his high blood pressure, it just controlled through his diet.
Okay, I understand. So no medications for anyone?
No,
Okay, good. Do you, as far as socially, do you drink alcohol?
don't drink, don't
No?
smoke.
No cigarette? Do you have any exposure to secondhand smoke? Are you ever around anyone else that smokes?
No.
Okay. What about any illicit drugs? Do you take any illicit drugs?
No.
No, okay. Have you ever done any of those three?
Well, back in high school, you know.
Okay, but that's been long past.
Long.
Okay, I understand. Okay. Is there any concerns that you feel like you have in particular, or do you feel like you have any health concerns?
No, not in my knowledge.
Okay, good. So I am going to take a quick look here at your scalp just to make sure everything looks good, and then we will go on down from there. Okay. All right. All right. I am first going to just take a look, and since I have washed my hands and sanitized them, and now I am going to inspect and palpate his skull. All right. Please let me know if you have any pain or you feel any tenderness. Okay. I don't feel any lumps or bumps. Good. Do you have any headaches? No? Okay, good. I am now going to palpate your preauricular and postauricular. Good. And I'm going to do your occipital, your submental, your submandibular, and your carotid lymph nodes. Any pain or tenderness? I don't feel any enlargement either. Okay. All right. Can you take a look at me? I'm going to turn off this light here and take a look at your eyes. Okay. I want you to look straight at me, straight at my nose, open wide. All right. And I'm going to just be looking at the side of your pupils and direct and consensual responses to light. Okay. All right. Look straight at my hypothyroid and consensual responses. I'm now going to palpate your sinuses, okay? I didn't do this initially, but I'm just gonna palpate your sinuses here for your frontal and maxillary, okay? Any pain or tenderness there?
No.
Okay. Any pain or tenderness there? No? Okay, good. Moving on down here, since we're, going on down, I'm gonna slide here just to take a look. So to inspect, cranial nerve 1, we will have you to smell. We're gonna say for this you can, I want you to occlude one nostril and tell me if you smell either vanilla or coffee. Can you occlude one nostril? And what scent do you smell?
Smell vanilla.
Okay. And occlude the other nostril. Okay. And what scent do you smell?
Smell vanilla.
Okay. And that would be cranial nerve 1. For cranial nerve 2, we would assess that with the Snellen chart. In this case, we're going to say you have 20/20 vision, okay? Moving along to cranial nerve 3, 4, and 6, I am going to have you look straight at my finger here, and I want you to follow just my finger. Don't move your head, just follow my finger with your eyes, okay? Okay? Okay, back here. Now I'm going to look for convergence, okay? And so what I'm going to do is, I want you to look again straight at my finger, and I'm going to move it in and bring it back out, okay? But again, don't move your head, just follow my finger. Good. Okay. Moving on down here, we can test your hearing, which is cranial nerve 8. I'm going to kind of come back here in the corner, and I want you to tell me what you hear me saying, okay? Can you close your left ear for me? Okay.
You saying apples?
Okay. And I'm going to come over here. Can you please occlude that right ear for me?
You saying peaches?
Okay, good. We don't have the ophthalmoscope, so we won't be using those. But moving forward, what I will do is, I've already assessed cranial nerve 8, which is the whisper test. We've already done cranial nerve 1, which is the smell test. So I am going to take a quick look at you here. I want you to clench your jaws together. Clench your jaw together. Good, good. And relax it. Okay. Can you open your mouth for me? And close. Open and close. Okay, good. I don't feel any clicking or popping. Can you stick out your tongue for me? We're going to assess your tongue here and side to side. Wave your tongue. So there you go. Good, good. And stick it out one more time for me and say ah.
Ah.
Good, good. I'm looking for a symmetry of your uvula, and that will let me know if there were any deficits. Okay, but everything looks fine there. So we have since again assessed your cranial nerves. That was number 12 that we just did as far as sticking out your tongue. For number 11, I'm going to have you to shrug your shoulders against my arms. Good, good, good. One more time. Okay, and those are symmetrical. Yeah, okay. So we're going to do that. Now I want to palpate your thyroid, okay? Just very quickly, I'm going to take a look at it here. I don't see any. I'm going to palpate here just a little bit after I've inspected it. I don't see any bulging or you're going to feel me wrap around your neck, and I want you to swallow, okay? Okay, can you swallow? One more time. Okay, good. Do you have any pain when I palpate?
No.
No, good. All right. All right. I am going to take a listen to your lungs here. I have an electronic stethoscope. However, I am able to change the settings from the bell to the diaphragm. So I will just change it via the buttons on my stethoscope here. I'm going to take a listen to your lungs, okay? I first want to just take a good look at you here. Can you just give me some good deep breaths? And I'm just looking for symmetry, just to make sure both of your lungs or both your chest is expanding symmetrically, okay? Now I'm going to take a listen, okay? And we are listening with the diaphragm here, okay? Give me some good deep breaths, okay? And I'm going to lift up your shirt here, okay? And I'm going to get up here so that they can see me, okay? Again. Okay. And again. Good, good, good. Now I'm going to come around back. And I'm going to do the same thing, okay? And I want you to, again, just give me those good deep breaths just like you were doing before, okay? And I'm going to lift up your shirt again so that I can hear, okay? Can you give me some good deep breaths? Okay. Good, good, good. Do you typically have any trouble breathing?
No.
No? Okay. Very quickly here, I am going to do what we call, or assess for what we call tactile firmness, okay? So each time you feel my hands on the on your back, I want you to say 99, okay? And I'm going to pull your shirt up again. I'm sorry. Okay?
99, 99, 99.
Okay, good. And now I am going to just kind of hop up here on the back of this table here with you, and I'm going to assess for symmetry again with your back, okay? Can you give me a good deep breath? And back out. There you go. Good. I'm going to pull this down. Now what I'm going to do is take a listen to your heart. I'm going to be listening to your aortic valve, your pulmonic valve, Erb's point, your tricuspid valve, as well as your mitral valve, okay? Just to make sure I don't hear any murmurs or gallops, and to make sure you don't have any additional S1 or S2, or we're looking for S1 and S2. We don't want any additional S, so S3 or S4, okay? All right. Okay, so we're now going to go to the second intercostal space on the right sternal border, okay? And I'm going to listen with both my belt and my diaphragm, but right now we're going to do the diaphragm, okay? And then we'll switch back over to the bell. And you can breathe through them. I'm just going to listen to your heart. Good. Now I'm going to go to the second intercostal space on the left sternal border. Okay. And we're going to come down to the third intercostal space on the left sternal border. We're going to move down to the fourth intercostal space on the left sternal border. And that's Erb's point, or I'm sorry, this is the tricuspid. Okay, and now I'm going to move to the fifth intercostal space at the midclavicular line, okay? And this is going to be your mitral. Okay, good. And I'm going to repeat the same thing, only now I'm going to do it with the bell. So I'm just going to be a simple changing of settings on my stethoscope. I'm just going to change the settings on my stethoscope and then we'll do the same thing, okay? I'm gonna come over here so that they can see me not listening through your shirt, okay? Oh my goodness. It is twisted. Okay. There we go. Good. Okay. So I don't hear any murmurs or clicks, any S3 or S4 sounds, which is good. Now with your blood pressure, with the hydrochlorothiazide that you normally take, do you find yourself having any swelling in your feet or swelling in your hands, any of your extremities?
No.
No? Okay. And you said you take those medications as prescribed, correct?
Yes.
Okay. Have you had any surgeries in the past?
No surgery.
Okay, good. Okay, so now I am going to just ask you a few questions here. Can you tell me, as far as your, we call it genital urinary and gastrointestinal, which is GI and GU. So GI is belly, GU is bladder, essentially. Do you have any problems with your bowels?
No. No.
Do they move regularly?
No.
So you don't have a bowel movement every day or every other day?
Oh yeah.
Yeah, okay, so that's normal for you. You don't have any trouble going to the bathroom?
No.
Do you have to strain whenever you do that?
No.
No, good. What about urinating? Do you have any problems peeing?
No.
No? Okay. Do you feel like you have to like go when you have to go, you really have to go, or do you feel like it kind of just comes on naturally and you're able to go?
It comes on natural.
Okay. Do you have any what we call musculoskeletal problems? So any movement, like any problems with moving or just moving, getting around, and
No.
any skeletal problems? No muscle issues. Okay, good. Squeeze my fingers for me. Don't break them, but squeeze them. You know, squeeze them. You can squeeze them. All right, pull me to you. Push me away. Good, good, good. We are now going to lay you back here so that we can take a look and listen at your belly. Can you lay back here on this table for me? Good. And if you want, you can slide up just a little bit, just so you're a little uncomfortable. There you go. Okay. Okay. You're about to overflow on this table. All right. So first, I'm going to just take a quick look at your belly. You can lay your hands here at your side. All right. Is there enough room there? Is there enough room? Okay. So I'm just going to take a quick look at your belly just to make sure everything looks good. And for the purpose of this video, we're going to say that you don't have any scars. Okay? So everything looks good. I don't see anything abnormal, so that's fine there. I am now going to take a listen at your belly, okay? What's wrong? Okay. And I'm listening for bowel sounds, okay? And this is just to see that or hear that your intestines are moving as they should be, okay? And I'm auscultating all 4 quadrants, and I hear bowel sounds that are appropriate. Good. Okay.
Yes, ma'am.
Now I am going to auscultate your arteries, okay? So I'm going to do your abdominal as well as your renal and iliac arteries. I'm just auscultating here. Make sure I don't hear any buoys. Good. Alright, so now I'm going to percuss. Percuss. Okay, so I'm going to percuss here, and this is just to see, I want to hear generally tympani, which is normal for the abdominal cavity, okay? In the right upper quadrant, I should start to feel some dullness, and that would be just a matter of your liver, okay? At that point, we can assess the span of your liver, but I'm just going to percuss your belly just to make sure, okay? You okay? Tickling you? Is it tickling? Okay, I'm sorry. And I'm just going to be going along this span, which is generally, it should be 6 to 12 centimeters is normal for an adult, okay? I'm going to bring this back down here. Okay, and I will also palpate in the 4 quadrants here. So I'm going to do 2 rounds of palpation. The first one is going to be light palpation. This is just, again, just to make sure I don't feel any masses or anything like that. And then I'm going to go a little bit deeper, okay? And that's just, again, to make sure there aren't any masses, okay? So now I'm going to palpate, or not palpate, I'm going to, palpate. Having pain or discomfort? Okay. This is light palpation, I apologize. Now I'm going to do deep palpation, okay? You can sit up now. So I'm going to assess for what we call CVA tenderness, and this is just essentially just to see if you have any tenderness in your kidney area, okay? So I'm going to place here and hit. Any tenderness? Okay, and what about now? No? Good. All right. I'm going to palpate your pulses here. Good. Nice strong bounding pulses, okay? And if I can, I'm going to take off this shoe here just so that I can palpate your heel pulses, okay? Do you have any problems with range of motion? You said no, you don't have any musculoskeletal issues. Good. I'll pull these down here also. Only for a moment, and then I will. Good. Just assessing your dorsalis pedis and posterior tibialis pulses, and they're nice and bounding still, okay? I'm going to keep your socks off, or keep your socks on, but leave your shoes off, okay? And we will be testing the range. You see me struggling just a little bit, but it's okay. It's all right. And I'm going to bring your shoes over here in this corner, okay? And after dealing with his feet and his shoes, I would have washed my hands again. So I will get some hand sanitizer. Mr. Doe, can you stand up for me? Alright, and I just want you to kind of simulate what I'm going to be doing here, although I'm going to have to modify it because I have on a dress, but can you raise your legs up for me? Some nice, good knee kicks. There you go. Alright, and what about kicking outward? Okay. Can you run your right shin or your right heel down your left shin? And what about your left shin or your left heel down your right shin? Good. Can you give me a side kick? And what about over there? Any difficulties with that? Okay, good. Okay, I want you to close your eyes and bring your arms out here with your palms up, and I want you to leave them out there and we're gonna rotate your palms here and leave them just like that. And we would do this test for 30 seconds. Okay? And you can bring those arms on down for me. Good. That's what we call the pronator drift, okay? And if you can, we're gonna kind of bring it back here into the frame of the video. You can, take a step here back towards me. And I would like for you to walk just to the camera and back with heel to toe, okay? So just do heel to toe with just good coordination. And are you able to turn around and do it again for me? Good, okay. And what I didn't have you do earlier, as far as your cranial nerves, I did not assess your cranial nerve 7. So can you smile for me and puff out your cheeks? My little blowfish, there you go. Okay, good. And that's just assessing your facial nerve, okay? Let's see, I believe we are all finished. I did not observe your cranial nerve 10. However, I did not want to gag you. That's like a gag reflex. So, but again, assessing your uvula, it was minimized. There weren't any deficits there. So, so that's good there. But you can say ah. So can you stick out your tongue for me and say ah? Okay, good. Now I am going to assess your reflexes. Can you have another seat for me? Alright. So I am going to do your biceps, your triceps, your brachioradialis, which is down here, your patella, your Achilles, and then the Babinski reflex, okay? I'm just going to slide this over here as a quick reminder. And all right, I want you to have your arms lax for me. Just kind of relax them out. Yeah, there you go. And I'm going to hold this up here, and relax your arm. There you go. Bend it, and you're going to feel me just kind of tap your arm. Okay. That's what I was afraid of happening, but that's okay. We're going to make do anyway, okay? Relax your arm, you're tense. Relax your arm. Okay, there you go. There you go. Okay, so that we have elicited that reaction, okay? Okay, and then we're going to swing this around here. Good, and I'm going to tap you again, okay? Okay, good. And we're going to try it over here. And I'm a left-handed, so we're going to have to modify this a little bit. There you go. You can relax your arm, relax it. There you go. And I'm going to test you out again. Good. And, okay, good. And there you go. And, okay, good. Now I'm going to do your patella reflexes, okay? Which is just below your knee. Or it is your knee. The patella reflex is your knee, but it's going to be assessing just below your knee. And I'm going to go ahead and pull this one right here up too. Okay, good. Alright. So now we're going to be, it's kind of difficult to do it like this, okay? do the same thing with your Achilles, okay? I'm just gonna go ahead and take off your socks here for the purpose of this video, and then we can put it back on, okay? So your Achilles. Okay. And for Babinski, what I am going to do is I'm gonna kneel down here, and you're gonna feel me take this pin, and essentially I'm going to rub it down the sole of your foot, okay? Make sure that, okay. It tickles? Okay, I'm sorry. All right. And again, I'm sorry. Okay, so that's Lee Babinski. Now, we will do sharp, dull sensation. So I want you to close your eyes. Close your eyes for me, sir. And we will do sharp, dull, okay? Tell me if you feel sharp or dull.
Dull. Sharp.
Okay.
Dull. Sharp.
Okay. And
Dull. Sharp.
okay, good. That's it. You can open your eyes again. Well, Mr. Doe, I believe we have finished everything. So I thank you so very much for coming in. You seem to be alert and oriented. You were able to answer all of my questions and do everything appropriately. So I do thank you. And again, thank you for coming on board, and I look forward to seeing you soon.